Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer. Fertility expert Dr. Amy Abazadeh.
And you have yet another success story
Just launched by an East Bay fertility doctor.
Welcome to the Egg Whisperer Show. I'm your host, Dr. Amy, and I'm so excited to have Dr. Linda Kim on with me today. Hi, Linda.
Hi, Amy. I'm so glad to be here. Thanks so much for inviting me.
Absolutely. You know, Linda and I have known each other since I was in Boston as a resident and she was a medical student. So that's how long back we go. So it's really awesome to reunite on today's show and to talk about something that's near and dear to my heart, and I know to yours too. And the title of today's show is The Most Important Part of Your Fertility Journey, and that is taking care of your mental health. Dr. Linda Kim is a Harvard-trained psychiatrist with many years of clinical and leadership experience. There's no one better to talk about this topic than her. Linda, tell us about yourself.
So, as Amy mentioned, I did my training back with her all the way in Boston. And since finishing my training, I came out to California and I immediately began practicing within a large healthcare organization. And I have served and have been so privileged to work with thousands of patients for over 10 years now. And over that time, I have gotten to learn quite a bit. So hearing people's stories, hearing their pain points, seeing people get better and what's been helpful and what's been really challenging, I really started to build this whole treasure chest of wisdom and tools and helpful bits. And so that's been wonderful. In addition to my clinical practice, I started to do more and more leadership administrative roles, and I loved that aspect too. And I also started to see how challenging it can be for women in terms of maintaining busy households, your childcare, family responsibilities, busy career, and so forth. And so that ultimately led me to really wanting to follow my passion and say, you know what, actually there is this gap, right, in terms of how we think about mental health care, especially for women in their lives. And so I knew that I just had to branch out and create Love Luck Health so that I could really start to be really specific and intentional in terms of thinking about mental health issues for women and the different challenges that they go through.
And I love the name Love Luck, LUVLUK.com. So that's a practice that you have, and it's basically a great model because people don't need to leave their homes to get access to great psychiatric care.
Exactly. Especially for busy professional women with a lot of, demands, childcare, school, homeschooling, and especially in this time of COVID too. Women have been asking for easier and more seamless ways of getting care so that they don't have to leave their houses, back in the day, find parking, get childcare, that kind of thing. And so it just by having a very easy and accessible virtual practice has been really impactful, I think, for the women that I care for.
Mm-hmm. And then what made you go into psychiatry and focus on women's health?
So the psychiatry issue is an interesting one. I actually thought I was going to become a surgeon. I loved being in the OR in medical school days, and it was really, I loved the thrill of it and that instant gratification, right, sometimes in terms of surgery. And I also knew too that I loved being given the opportunity to hear stories and really enter someone's life in a very personal way. I'm an avid reader, and I feel like every time I meet with someone and I can share their experiences and they tell me their backgrounds, I feel like I'm kind of being invited into another person's life. And so that's just been one main reason why I entered psychiatry. And also too, I see that people get better. And so that was another really important thing for me. It might not happen overnight, but definitely it happens over time. And I just love being able to have a true impact on people's lives. So that's why psychiatry. And for women's mental health, I have to say that's a really personal thing. So I am coming from a family with 3 girls. I have 2 older sisters. I have 3 daughters, so you can imagine any get-togethers. We're just, all women running around the house. And, especially for infertility, both of my sisters, they struggled. They both went through IVF. One sister, she was successful in terms of getting a pregnancy. She has two beautiful boys now. And one sister, she ultimately did not end up getting pregnant, having a baby. And now she's the favorite aunt. And my daughters actually prefer being with her at all times rather than with me. So happy endings, everyone found their joy. But I also saw and witnessed how challenging, this process of trying to conceive and infertility can really take on someone. And that's why I really wanted to create some resources and support mechanisms for women going through this.
And you've definitely helped my patients. And I just love everything that you're sharing with us. And thank you for sharing the personal side as well.
Sure.
So what are some of the common mental health issues that you see in women?
So it spans the entire spectrum. Obviously, the most common mental health issues are things like depression and anxiety. I also see bipolar disorder, PTSD, schizophrenia, ADHD, everything in women. But I do know, and actually the statistics pan out, that women are more commonly affected, right? So for depression, they're 2 times more commonly affected. The lifetime prevalence is 2 times that in women than it is in men. And same for anxiety. It's 1.5 to, even more to prominent in women than in men. And so there is, we see that clinically, but also too, there are now more hypotheses in terms of why, trying to understand why. And there has been a lot of research into really starting to peel back the onion layers into figuring that out. And a lot actually goes back to the fact that we have different hormones as well, right? We have our menstrual cycles. We have these really huge shifts in estrogen, progesterone, LH, FSH, whatever it may be, in pregnancy, menopause. And that hormonal, contribution actually is something that is quite significant in terms of mental health issues.
Yeah. And I love how you say that it can be fixed. There is a solution. And so seeking help is so important. So how would someone know, and you've helped so many of my patients, and thank you for that, but how would anyone who's listening to this know if they need help or if they need something like an antidepressant?
So I love that you asked that, because I get asked that all the time. A lot of times people and women, they sit at home and they suffer alone, and actually there have been studies done that tell us that the average wait time before someone gets help for something like depression can be 8 years. So imagine that someone is suffering by themselves without getting the treatment, and they can feel better. What I generally recommend is that, first off, I'm not here to pathologize anything in terms of the normal ups and downs of life, right? We all get hardships. We all feel sad. We all feel stressed in relation to normal life circumstances. But the thing that you can start to monitor is if that doesn't go away, right? The feeling of being off or sad or immensely irritable or anxious, if you get stuck in that feeling, and then what we like to use is actually like to use a 2-week period of time. So for example, let's say you're starting to feel that way, really sad or poor energy, or you just don't feel excitement or joy from anything, and you feel that way either more than half the days or nearly every day for a period of 2 weeks or more, that really is a tip off that maybe you should reach out to someone and consider getting help, because we don't want you feeling that way. And generally when we have the normal, fluctuations in life, you feel that, and then, they go away and you can get back to your routine. Another way that I recommend is if it starts to impact, what we say is it starts to impact your functioning, right? So you're either not as productive at work, you can't concentrate, you're starting to get your supervisor to come and say, Linda, is something off? I'm starting to notice something. Or you might even find at home that your loved one, your partner, is saying, I'm noticing something different about you. So we do look at that in terms of if it's affecting your functioning too.
And then my other question for you is, it's confusing because as you're a fertility patient, you kind of feel like that all the time.
Yeah.
Right? And I find that my patients sometimes think that those feelings can cause infertility, and then they feel stressed, and then the stress is that causing the infertility. What do you think about that? Does stress really cause infertility?
That is such a myth. So people say, oh my gosh, I'm so stressed out. That's the reason why I'm having these troubles. And it's really not the case. So even though we know that stress does not cause infertility, and that's actually, if they want to know what's causing their infertility, that's why they seek out your help, right? In terms of looking at the anatomy, looking at their age, all the regular markers about the big tip-off reasons why they're struggling with infertility. The flip side is true, though. We know that infertility does impact the way you feel and causes stress. So when they have done studies, some studies show that women undergoing infertility treatments, they have as much stress as someone who just had a heart attack or someone who is facing cancer. I mean, it can cause that much level of stress, right? And so definitely it's like that. It's, the things are so intermixed and you're feeling so overwhelmed that you might think that, but it's not something that is causing your infertility. We do know too that stress can impact, right? It can influence, it can feel how emotionally well you feel during your infertility treatments. And that is something that is absolutely treatable, right? We want you feeling as best as you can, managing your stress so it's lowered as much as you can, so that you increase your emotional wellness, and maybe that also can increase the outcomes, right, of how you are feeling during that time. So I don't want you to go away thinking that you shouldn't be proactive in your approach in terms of managing the stress while you're going through infertility treatments. You absolutely should be proactive in doing that.
I couldn't agree more. And I think of a fertility diagnosis as, I tell my patients, it's like having a heart attack in your uterus, right?
Yeah,
literally.
Absolutely.
So you just mentioned managing the stress. So what are your recommendations to people who are listening and watching as to how we can best manage our stress during fertility treatment?
It's interesting because the women that I work with, they come to me and the first thing that they say is, people tell me I should not be stressed and people tell me I should be, relaxed or to relax. And they say, how do I do that? No one ever tells me how, right? It's like, it would be lovely if I could turn on that like on and off switch and just say, poof, I'm just relaxed now. Great, I can start. And that's the kicker. I mean, that's really why I've kind of taken all these different experiences in my past working with thousands of women to create just a new way of looking at it, because it's not something that's pathologic, right? You're not seeing me for depression or for generalized anxiety disorder. You're seeing me or getting help because we know that you're going through a really challenging and stressful time. So what I really try to encourage people to think about is, okay, like think about that athlete who's going off to the Olympics, right? We know that they are training. We know that they're excited to be there. We know that this is a life event, right? That they've worked their whole lives towards. And we know that there is a huge amount of stress, a huge amount of pressure, huge amount of expectations that they're putting on themselves, and others are like the whole country, right? They're putting their expectations on you. And so I really like to liken the process of going through infertility treatments with an elite athlete who's going off to the Olympics because of all these different really, high stakes, high hopes, high dreams, factors that are at play. And so when you start to think about stress reduction in that way, I start to think about it, okay, so what do we know and what can we use, in this really complex arena that women are in? So the first thing is actually going back to the basics. So in my model, I've really created a way to systematize this, in which I call the Love Luck method. And that just helps me start to piece it apart and make sure I'm not missing anything. So like, for example, that L is the love yourself, right? And what we think about is love yourself by doing the self-care and by creating your core network of folks, right? This is your like coaching squad, your team, your people who are behind you, rooting for you. And it's important because self-care is actually evidence-based in terms of stress reduction techniques, the healthy diets, the exercise, mindfulness, those type of things that we want you to do. But we kind of just bundle them together in terms of saying you're going to take care of yourself, you're going to love yourself, and you're also going to make sure you have those loving supports around you, right? Who's your team? We know that there are people who are actually really good for you and going to be your cheerleaders. And we also know that there are some people who might not be the most positive factor in your life, right? A lot of questions or critiquing. And so you want to start identifying who those people are and then choosing who's going to be on your team. I also too believe in like the amazing power of your mind, right? In terms of the visualization, the imagery of what you can do for yourself. And we see a lot of that in sports psychology, where you have these elite athletes, right, who are training and they use very, very concrete ways of visualizing different things and making sure that they are mentally prepared for some of these different challenges. So some of it is that too. The V is actually for variability, so the heart rate variability and utilizing your vagus nerve. So I specifically point to this one as something that's super easy for you to do. It's really about the breath. I'm not going to go into it in too much detail. Just understand that there's a huge amount of evidence behind this in terms of the abdominal breathing. It's a very specific type of breathing, and how it helps you utilizing the vagus nerve, which is so interesting in terms of its anatomy, and how that can control your parasympathetic nervous response, which is the exact opposite of your sympathetic nervous response. It helps you bring down your stress levels. And there is this, again, this burgeoning kind of wealth of knowledge in terms of how you can use that to really affect your heart rate variability, which is to actually counteract that stress response that you might be facing. So that's another piece of it. Another piece actually is just what we all talk about in mental health. It's those logical methods, right? It's the CBT, it's the DBT, it's knowing what the negative thoughts are in your mind and how to reframe them and shift them so that it actually lets you look at the situation in a different way and find different types of solutions. And then we also think about, how do we know that, if some things are unchangeable or out of your control, how do you find ways to actually decrease your distress or stress around them? So there are different pieces of doing things, but it actually is quite doable. I mean, they're very tangible. It just is so interesting to me that we've never really captured them all into one package and, just taught women how to do it. It's very accessible and it can help you feel your emotional best while you're going through this really challenging process.
Well, thank you for that explanation, because as you were speaking, I was doing my abdominal breathing and you were reminding me, and I already feel much more relaxed.
Excellent.
Yeah, thank you. So one of the hardest parts of my job, as you can imagine, is calling people with negative pregnancy tests. I mean, I feel like I want to go to their homes, wrap them in something really soft and just give them a huge hug and just tell them everything is going to be okay. But I know that not everyone has a provider that can show and give as much empathy and compassion, just because sometimes people get calls from other staff members. Sometimes it's a voicemail, sometimes it's an email, sometimes it's days later without a plan. And that can be really challenging for people. So I would love for you to kind of talk through, what can someone do to cope with a negative outcome? Even if they have someone supportive on their team, it's going to be hard.
Absolutely, Amy. I mean, this is one of the hardest things a woman can face, especially after this, it's a challenge, right? I mean, there are shots, there are hormones, there are doctor's appointments, there are these, the hopes and the dreams and the expectations. The first thing is, give yourself the compassion and give yourself the time to grieve. It really is a grieving period, right? It's filled with the sadness or that loss of that expectation of this cycle, or it's disappointment, right? And some women have told me that one of the hardest things for them is they feel like their body has failed them in a way, right? Like, I've been so successful all my life. I've run marathons. I'm CEO of this company. I can multitask and do 20 things at one time. How come I can't get pregnant? And so there's this sense of failure too, and it hits herself. I mean, it can go the full gamut in terms of the emotions and how hard that can feel. And so the first step is just give yourself the time to grieve. And we know that there is a grieving process, right? In terms of Elizabeth Kubler-Ross's grieving stages and getting to the acceptance, it just takes time. It's a process. So give yourself that time. The second too that I would really recommend is that this notion of checking in with yourself and checking in with that emotional barometer. You won't know where you are in terms of that unless you start to understand emotionally where you are. So this idea of having this emotional barometer is, okay, on this day, I actually am checking in with myself. I might feel okay, right? Maybe a day after, or 2 days after, or 7 days after, whatever it may be, you're starting to feel better. You're starting to interact a little bit more. You're starting to, get your funny side back a little bit more. And then the next day, boom, you're back in, feeling really depressed and really sad and crying. And that's okay. But you just want to make sure that you're checking in with yourself and not expecting yourself to always be like, oh, once I pass that stage, I'm happy, I'm good now, and you can't go back. And so what it does is if you don't check in with yourself, you start to get surprised, right? And then you start to feel like you're not making progress. So it's just this practice and this habit of checking in with yourself and noting what your emotional barometer is. The third thing I'd really recommend for people is that once you do that, once you give yourself time, you're checking in with yourself, is this notion of try not to get stuck, right? And so what that is when you start to let the negative thoughts and the self-doubt and the worries and the anticipatory anxiety start to really crowd things out in your mind and get the louder intensity of or volume in your mind, you don't want to get stuck in that pattern. So once you identify that maybe you're getting stuck, and again, this is Amy, to your point in terms of, when should people get help? If you notice that, then that's when you might want to reach out to your loved one or to a family member or friend and just let them know, today I'm not doing so well. I can't kind of, shake this, start that process of getting help so that you don't get stuck. And then the next thing too is just this notion of being really proactive in terms of what your plan is going to be like, right? So when you move through that and you start to think about the next steps, I really encourage you to have this very proactive plan about what's next. If it's A, you're going to try again, and this is what it's going to look like, great. If it's B, you actually feel like you're done trying, you are good with moving on to some other option or whatever it may be, then this is what the plan is going to look like. It's just, again, this notion that this doesn't have to be a passive process. It really can be a proactive process where you actually take the steps to make sure that you're feeling the best that you can. That's one of the important pieces of moving forward, right? I will pause just to say that one thing that can be really helpful here is, and I will say this, even though I will admit I get like the eye rolls, and it's easy for you to say in terms of some of like, the mental health wellness things like the gratitude journaling that we talk about. I get it, right? It's like people say, oh, I don't want the woo-woo stuff. It's not necessarily woo-woo. It's like evidence-based. So it's really good evidence. And what I tell people is that when you do that, it's not just about the act in the moment of doing it. It's actually, it's training. It's almost like exercising for your mind for the future. And it's helpful when I tell people what it actually helps you train for. It actually helps you train to hold two dual emotions at the same time. So when you are going through a really challenging time and you're feeling so down and so devastated and a lot of grief, your ability to see that one moment, right? That maybe it's a wonderful smell, or it's like, someone baked cookies, or it's that the way the sun is setting outside. As you start to journal, whatever it may be, your mind develops the muscle to hold both pain or sadness or grief and beauty and wonder and joy at the same time. So if you do that, it's actually training your mind for any type of possibility in the future. So actually, I really encourage that, even when you think it's your hardest time, okay? And then finally, just going back to that idea of being proactive, like what's the next thing? I really encourage people, if, for example, if you know the date of what it's going to look like, you wait 2 cycles, you're gonna start again. On the day of the embryo transfer, I ask people, what time are you gonna wake up? What are you going to have for breakfast? What's going to be your mantra? Have you visualized what the room looks like? After you visualize it, what's going to be your celebratory, thing you're going to do for yourself? Is it going to be the flowers? Is it going to be the music? How are you going to, again, it's almost like an athlete preparing, right? We plan it out step by step so that you can visualize, and then there are, less surprises during that time. Again, it's just being proactive and knowing how to empower yourself, during whatever you choose to engage in.
Right, because your mind can just feel like it's in chaos.
Yes.
And if you take control, your mind is so powerful. And what you are sharing with us is so helpful. And it's the same stuff that I talk to my patients about, but of course you say it in a much better way. So thank you. So I see a lot of patients who are coming in and they're on antidepressants, and then sometimes they even stop them without even asking, and they think that that's what they're supposed to do based on a Google search. What recommendations do you have for people who are already on antidepressants, starting IVF treatment, who are scared that maybe somehow it's going to, hurt their IVF success?
So that is such a great question, Amy. I get that all the time. What I say is that we know, right? And this is even with moms who are pregnant and are on medications. They can be on really, multiple cocktails of medications. Fundamentally, the way that we approach things now, and it's different from a few years ago, or definitely different from 5 or 10 years ago, we want mom or the woman to feel as best as she can emotionally, preconception, during pregnancy, and postpartum as much as possible, because that is the best for everyone, mother, child, family, everyone. So we really, really encourage you to take the steps. If you feel emotionally well on your antidepressant, it's a one-on-one conversation with your clinician, but for the most part, when I work with women, I say that is helping you feel less depressed. It's helping you exercise more. It's helping you not go to the alcohol or, other unhealthy behaviors. It's reducing your stress. It's making you eat better, all those different things that people don't think about, right? It's helping you do that. And that's the best for you during this time. Actually, when we look at it too, and the amount of stress hormones that get released, those antidepressants, if they're helping you with your mood and anxiety, they can actually help with how your body responds to stress when you're undergoing these treatments. So again, the fundamental rule is we want the woman to feel as emotionally well as possible throughout the whole process.
Right. And I want the experience of being a fertility patient to always be a positive one.
Yeah.
If my patients are waking up in the middle of the night with panic attacks and they're not sleeping well at night and their circadian rhythm is disrupted, of course, that could affect their outcome. And so I just want people to hear from an expert. We have Dr. Linda Kim, psychiatrist trained at Harvard, clearly like one of the best experts we've had on this show, tell you it's okay to still be on antidepressants, but of course, talk to your physician about what's right for you.
Absolutely. I can't, impress upon all of you enough that for the most part, if that antidepressant is helping you feel well, it's very rare that I would recommend someone to get off of it, just to entertain, IBS. Of course, it's, depending on the individual comfort level and so forth, and definitely talk to your doctor, but the goal is to have you, enjoy the process as much as possible and feel well.
Yeah. Well, thank you, Linda, for coming on today. For those listeners who would love to be a patient of yours, where can they find you?
You can find me on www.loveluk.com. I provide individual therapy and psychiatric services, but I'm also developing more group programs, especially for women who want to maximize their emotional wellness during infertility. So there's a lot there. I'd love to have you at least, just learn a little bit about how to take care of yourself emotionally. And, I just really love being on this program, Amy. So thanks again for inviting me.
You're very welcome. And people can sign up for your newsletter as well if they go to your website to get more updates from you too.
Exactly. Absolutely. Just, sign up for that newsletter. I do send out updates in terms of women's mental health issues and overall wellness issues. So please do sign up. And you can also find me on Psychology Times as well.
Thank you, Linda, for joining us today. I can only imagine how much the information you provided has helped those who are listening. I appreciate all the work that you do, and mental health is the most important thing to me, to make sure that my patients feel emotionally well during their journey. So thank you for providing all this great advice.
Thank you, Amy.
Bye.
Bye-bye.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer. Fertility expert Dr. Amy Abazadeh.
And you have yet another success story.
Just launched by an East Bay fertility doctor.